topic of discussion, that is a donor IVF cycle. Well, in life, when we don't have something, it is always said that we either beg, borrow, or steal. But this is definitely not possible when it comes to human gametes. Or, as in simple terms, gametes are two types, that is sperms and eggs. We cannot steal anyone's sperm or oocyte. So we have to go to an infertility doctor who would help the patient procure these gametes through licensed places in a scientific manner. How do we do that? Why do we do that? What are the legal parameters? What are the advantages, disadvantages, and what are the criteria that we use when selecting the donor gametes? I'll go through all these things in a stepwise fashion. Firstly, let's talk about when do we need a donor gamete, that is either donor sperm or oocyte. In simplistic terms, when someone doesn't have a gamete, either oocyte or sperm, we have to get it or source it from somewhere else. A lady who has had ovarian failure, premature ovarian insufficiency, or has attained premature menopause, a man who is absolutely azoospermic, that is, there is no sperms in the semen, we might have to source his gametes from outside. Notwithstanding this, it is prudent to put across here that in the scientific world of today, where advances have been made to a great extent, this reason for gamete sourcing has decreased a lot. Even in cases of azoospermia, we can do surgical sperm retrieval to get the correct sperm. That is, retrieve the sperm from its site, either by aspirating it with injection or doing a small surgery on the testis, taking a small biopsy-like piece of the testis, looking for sperm, and using that sperm to give a biological child. But at times, it is never successful, or many a times it is never successful. Another reason why we would actually source gametes from outside is when there is a defect in gamete. There is a chromosomal anomaly. There is an uncorrectable chromosomal anomaly in the person which has a likelihood of being transmitted down to the child. You can either opt for a procedure called as a PGT, that is pre-implantation genetic testing, or else go in for something like a gamete donation. The advantage of gamete donation is that it's definitely cheaper than doing a PGT. It helps the patient to achieve the pregnancy earlier, and the waiting time is definitely reduced. The cost per se in a PGT cycle might almost be double than that of a donor cycle. So it is prudent to actually do a donor cycle when your finances aren't just right. It might not sound very scientific though, but yes, there is definitely an option of a donor gamete here. Some ladies have a contraindication to surgery. The lady might be suffering from some serious medical condition wherein the oocyte pickup or ovum pickup cannot be done, or a male cannot give a semen at any cost. I mean, in that case, it is always prudent to go back to the banks and pick up a gamete of your choice. How do you go about this? I mean, how do you come to know? Of course, you have to visit a reproductive medicine specialist, or as we call ourselves, the IVF specialist. You have to knock the door of the specialist. We do a lot of investigation before we actually recommend a donor gametes. These investigations include, in the female, testing of the ovarian reserve. There are various tests that we could do, either static or dynamic testing. We'll not go into too many details of this. But however, when there is no gametes that can be sourced, we are left with no option but to source it from the bank. Once we have decided that we have to do a gamete donation, there are certain banks that we go to. The movie Wiki Donor must have actually opened the information basket when it comes to semen donation. Well, it isn't as light as they put it across in the movie, but there are stringent rules which actually govern this process. Number one is that in semen donation, we don't, or we rather never use a fresh semen sample. It is always a frozen semen sample. This sample is quarantined, as we are all quarantined now. I mean, we are in a more mild quarantine. I mean, I pity the people who actually have COVID infection and they are actually quarantined. But yeah, this semen sample or oocyte sample is quarantined for about 6 months, and then is given to the person who actually the recipient. In the meantime, one actually does a lot of tests. We have to rule out infectious etiology that can be passed through the gamete, as HIV infection, HPSAG, HCV, some sexually transmitted diseases like syphilis, etc., which are screened and kept. The 6 months quarantine is basically the person is tested again after 6 months, making sure that the sample was not retrieved within the window period of infection. I guess with the COVID spread around today, all of us would know what a window period is. Now, once this sample has been given for or is being marketed for donation, we give a set of information to the bank, that is the blood group, the height of the individual, weight, the skin color, educational status, and if there is and these are things that we provide, and then the sample is given to the clinic. It is also made sure by the bank that there are no transmissible diseases in the semen sample. That is, it could be diabetes, which is genetically transmitted, or it could be thalassemia, which is again genetically transmitted. And the source of the donor gamete is a healthy individual. The ICMR, that is the Indian Council of Medical Research, which writes guidelines for all of us as to where to source the sample from, has an age limit. Oocyte donation, the donor's age has to be between 21 and 35. When it comes to semen donation, it has to be between 21 and 45. The donors have to be absolutely free from any known medical illnesses. Okay, now that this gamete arrives to the clinic, we match. I mean, obviously the parameters, the patient's parameters are there in front of us. The donor gamete parameters are there in front of us. We basically match those, and we could use those. Semen donation is simple because it has been around for a long time, more than a century. Initially, we used to use semen freezing when it comes to veterinary usage, and for the last 50 years or so, we have been freezing human sperm and using it for procreation. But when it comes to oocyte donation, we are still evolving. The ideal oocyte, the donor oocytes are meant to be fresh oocytes. But sadly, at times, what happens is in India, most of the oocyte donation is fresh, which is wrong according to scientific parlors. We have to source the oocyte from the bank. We are slowly trying to evolve into 100% bank oocyte donation cycles, which we will slowly and surely, because all the IVF clinics are moving towards the correct path. Unfortunately, in India, the bank oocyte are the centers providing bank oocytes are very few in number. So most of the people actually do a fresh oocyte cycle or fresh oocyte donation, where the oocyte is sourced through a live donor. Okay. Once we use these gametes, we make an embryo. We could either transfer it in the same cycle or we freeze it. We do something which we call as the frozen embryo transfer in the next or whenever the patient is free, whenever the recipient is free, and transfer it into the uterus. A lot of success not only depends on the quality of these gametes that you're sourcing, but also depends a lot on the uterus where you're placing. If at all there is a problem in the uterus, like there is a congenital anomaly, there are fibroids, there is Asherman syndrome, there's adhesions within the walls of the uterus, adenomyosis, all these things, infections again, all these things are an impediment to successful implantation. So it is very difficult at times to actually pinpoint the success rate. A good gamete will definitely form a good embryo. Good gametes are ensured since the sourcing is mainly from younger individuals. But a good uterus, a good bed of implantation, a good soil for the seed to grow into a good tree is provided by the patient herself. So, a lot of times, cycles do not succeed very well is because the uterus might be at fault. However, the donor cycles are blessed with a wonderful success rate of at least 60%. I'm putting it at a very, very low rate of 60, but in centers it might go up to 75, 80, 90% also, because primarily age is a very important factor in the success of our procedures. As far as the patients are concerned, they know that they have to go for a donor cycle. How do we actually go? Whom do we contact? Which clinic do we go? It's very difficult for the patient to actually pinpoint a clinic as to where to go. But as in putting it absolutely in layman terms, we have a guiding body called the ICMR, and most of our clinics are to be accredited to the ICMR or the NARI registry, that is the National Registry for Infertility Clinics. I would suggest all patients to find out one of these clinics where the accreditation is done and knock the doors of these clinics. Of course, ask the former patients, ask their experience as to how it was in that clinic before you actually go and register yourself. Look into the websites. A mere point here is websites can be at times misleading, but I think the best source of information, as far as most of us are concerned, is an opinion from a colleague or a past patient. All these things would help us to go to the correct clinic. Make sure that there are not too many middlemen between you and the doctor. All these things would increase the success rates of your cycle. The closer you are to a doctor, the better success rates you would be blessed with. Well, of course, all cycles where donor insemination or donor this thing is used, oocytes are used. The clinic also does maintain a record of where the sourcing of gametes are from. Unfortunately, even today, the rule position when it comes to IVF clinics is not fructified. It is not crystallized. It is still in fluid state. The ART bill, which was proposed in 2010, has not yet been passed in the parliament, even though it is halfway through it. We'll have to wait for this bill to become law, and the law will be more rigid and applicable to most, to all rather, not to most. This law will determine as to exactly how many years these records have to be maintained. As far as the Western this literature is concerned, the clinics have to maintain it for approximately 10 years, and then we are supposed to send it to a central registry. A very important thing is that the donor and the recipient should not know each other. This is very important. A lot of patients walk in, use my sister's oocytes. It is not allowed by law. The sourcing of gametes has to be absolutely anonymous. If one does know the source, it might actually lead to problems in the future, both for the couple and more importantly for the child. There could be a lot of legal issues which follow if you know the source of the gamete. Hence, the ICMR has maintained absolute anonymity when it comes to sourcing of the oocytes. It is not an easy decision to take. How can I How can I, as an individual, take a oocyte or a sperm from someone else? Well, it is a very difficult choice, and all said and done, it is a decision which the couple should take as a team. My suggestion to most of the couples is and will be very simple. The decision has to be between the husband, wife, and the doctor. Don't let any family members come into this equation. They might give you opinions which might not be scientifically suited. There's this old saying which goes, too many cooks, you know what will happen to the broth. It'll definitely get spoiled. The less the people know about a donor sample usage, the better it is, not only for the couple, but also for the child. You are talking of about 60, 70 years that the child has to go through. You can't label a child as a donor inseminated or a donor oocyte child. So the secrecy, the confidentiality of the entire procedure is a must. And hence, this talk between the husband, wife, and the doctor should be given utmost importance when it comes to sharing. Make sure that you take a decision, stand by it. In IVF, when you accept the donor sample, it is a big step that you take towards achieving parenthood. I tell to a lot of my patients, what you pass on to your child is not at times genetics. What you pass on to child is values. If you pass on the correct values to your child, the children, the future generation will look after you irrespective of the source of your gametes. And another pointer at this point of time, I would like to tell all the patients who have been lined up for donor cycles is don't look back. At this point of time, you have made a decision, it is right. It cannot be wrong. There are no wrong decisions in IVF. It is only accepting this decision and taking your life forward from there which is most important.